Hello, everyone. I'm excited to be on today. As we kick off today, I actually want to start with a brand new study that just came out, and there's actually a lot of talk, a lot of hubbub about it. And I just wanted to really give you some clarity on what this study shows. So the study was from the I'm trying to remember what it's called, National Toxicology Project, something like that. And what they did is they did what's called a meta-analysis. And a meta-analysis is they're looking at a whole bunch of research, a whole bunch of different research articles and studies, and they're putting them all into kind of a filter, a sorting hat of sorts. And they're saying, okay, what is the quality of this research? Meaning, did they have enough people they were looking at? And did they follow correct scientific protocols and all of these different things? And what is the confidence level that what they're finding and what they found is actually true? So they were looking for fluoride and saying, does fluoride cause health issues? And they wanted to see particularly one thing. They were looking at neurodevelopment in children leading to IQ levels. Very specific, very focused. What this meta-analysis showed was a direct correlation between fluoride levels, ingested fluoride levels, and lower IQ levels in children. Well, right off the bat, everybody's going to have a fit about this, right? What? Fluoride causes IQ issues in children. We've actually been talking about this for a little while. But this is just a big article that just got picked up by national news stories. So I want to give you some clarity a little bit on this. First of all, because it's a meta-analysis, we do give more credibility to it because it's looking at a lot of different research and it's evaluating their credibility. So it is the highest level of basically research strength to say, yes, this is good research. So we know that already. The second thing we want to look at is what were they really looking at from a fluoride level standpoint? So they were looking at fluoride levels at 1.5 milligrams per liter. In the United States, the recommended dosage in water supply is 0.7 milligrams per liter. So they were looking at levels double what recommended water levels are in the United States. They were looking at China, India, Canada, a whole bunch of different countries, Mexico. But here's the thing, they weren't just looking at water levels. They were looking at cumulative fluoride. So where else are you going to get fluoride from? Of course, from toothpaste, mouthwash. If you're not using our fluoride-free hydroxyapatite versions, you're going to get it from there. Also, this is what a lot of people don't realize. If food, manufactured or processed food, has been processed in a place that includes water, and if that water has fluoride in it, it's going to be incorporated into the processed food. The same with beverage, and particularly with beverages. So have you ever thought about it? Okay, I'm drinking this drink, let's say a bottle of kombucha. Well, that kombucha has water in it. Where did that water come from? And did the water actually have fluoride in it? Sometimes the answer is yes. So we're getting cumulative fluoride levels because of food we're eating, beverages we're drinking, water or fluoride in our water itself, and then also fluoride in our dental products. So is it possible that even in the United States with lower water fluoridation levels, we're going to get to that level easily? And that's what they found is easily this is happening. So fluoride does cause IQ deficits in children. This has now been proven. What do we do about it? The exact same thing I keep telling you. There's no reason to use fluoride. There is no reason because we have hydroxyapatite, which does substitute the exact same purpose of fluoride. It keeps teeth strong. We don't need to use something that has these detrimental side effects. There's no reason to. There's an alternative now. So that's why in our practice, we use nothing fluoride related, nothing fluoride based whatsoever. We use no fluoride. And I recommend fluoride-free everything. And it's possible now. Here's the interesting little turn of events that came about. So just this weekend, this was released late last week, and I started getting forums, dental forums saying, oh no, this new study just came out saying that there are going to be IQ level issues with children because of fluoride. What do we do? How do we defend fluoride? And I just kind of scratch my head and I say, well, we don't need to defend fluoride. We should be defending the children. That's who we're defending, not the fluoride. Why are we living and dying on this mountain of fluoride? There are ways to give children happy, healthy, cavity-free teeth for life without ever ingesting a drop of fluoride. So we don't have to defend fluoride. And a bunch of dentists reached out and said, how can I do this? Like, what can I use instead? How do I talk to patients about this? Like, I want to be on the same team as them. That's what I'm trying to do as well. So I have a whole bunch of interviews lined up talking about this, that you don't have to do this. There's no reason to have fluoride anymore. And so hopefully we can get the word out and you Actually ask this of dentists wherever you are as well. Say, I heard the hydroxyapatite's just as good. Do you have alternatives for us that we can do? Because we've chosen as a family not to do fluoride. We've looked at the research, we understand it, and we don't want it. So do you have hydroxyapatite? We've heard that's a great replacement. So I just actually have a mission, Living Well with Dr. Michelle. Part of my mission is to help clear a path through the mountains of information that surround us every day. That's what I hope to be able to do, to show you these things, like the truth about these research studies, and say, yeah, it was good research. They were using higher levels than what we use. However, can we get there? Yes. And any level is going to cause some level of concern. There's no reason to anymore. I am at the forefront of research, and everything, because I have to be. I have to be able to defend what we do. And I am here to help you. I just want to show you what I do, what I know, and what I learn. All right. Thank you. I have some support on here already showing up. Thank you. My 23-year-old son has no fluoride. Excellent. Minimum in life too. Yeah, excellent. Beautiful, healthy, cavity-free teeth. That was one thing that kind of ticked me off. On one of these dentist forums, one of the dentists wrote, great, more cavities for us to fill. Great for business. I was like, okay, you're a jerk right off the bat. Because that's not the way to look at this. Great. People are going to not be using fluoride. Great. I have more business. No, there's alternatives. Give you the alternative. We don't need cavities. Cavities can be a thing of the past with correct, proper materials we're using at home and care at home, materials at home, and care in the dental office. Okay, so let's grab these questions. Thank you for teaching videos and your high quality dental products. I want to share them with my friends and family. So grateful for truthful doctors like you. Thank you. That's actually one of my guiding principles for living well with Dr. Michelle, also, is transparency and trustworthy. I want to be able to be very open, and you can just know that what I'm saying is what I believe, straight up. What are your thoughts on oral red light therapy devices? Good question. And it depends on the oral red light therapy device we're talking about. If we're talking about one that's going to be used for whitening teeth, I believe that the light is simply kind of a gimmick. It doesn't actually do a lot for it. If we're using red light to stimulate, let's say, bone growth in an area, or bone healing, more like bone healing in an area, gum health, airway, to try to strengthen some muscles in the airway. All of those are actually great uses for red light therapy, but most of them don't need to be done intraorally. They can be pointed intraorally. So it's like a flashlight, the one that we recommend, and you can point it back at the back of the throat. You can point it down to the gums. You can do all those kinds of things. You can actually use it from the outside of the face too. And what the red light does is it actually stimulates mitochondria. Mitochondria are the powerhouses of the cell. This is actually in my new book, which, so excited, the name, just incredibly innovative, Living Well with Dr. Michelle. We literally went through scores of titles and different things and trademarks and everything else, and they just came back to that, said that's the title. So in Living Well with Dr. Michelle, you are going to be learning about mitochondria and about literally how those are the powerhouse of your cell. And they are what create energy. Energy for healing, energy for health, energy for staying well, energy that you want to feel, that you feel, all those kinds of things. So more mitochondria, more mitochondrial activity, the better. So red light stimulates that. So it increases healing activity, it increases health, it increases all of those things in the cells itself. So it's great. Okay, I showed my dentist your tooth cleaner and she loved it. So excited. I'm so glad to hear that. It's hard to find a dentist near me that won't listen to me when I insist on no fluoride. Well, first of all, it's your mouth and it's your body. So you can just say, I'm not going to do it. So what alternatives do you have for us? I'll have all this information on the Living Well site as well, on what dentists can use, what you can use. You already know what you can use: tooth powder, hydroxyapatite, tooth powder, mouthwash, all of that. But dentists, there actually are hydroxyapatite products that they can use as well. And so we'll make sure to highlight all of that. How long can you have an infection running in your bloodstream before something serious happens? I have an infection from my root canal. Well, I guarantee you something serious is already happening, because when you have an infection, that infection has already spread. Every time you're chewing, it's going to spread throughout the body. And anytime you have low dose chronic infection like that, it's asking your immune system to work overtime. Well, anytime your immune system is working overtime, it's going to get distracted. It's going to get overwhelmed. It's going to get overworked. And we'll typically see autoimmune or other immune issues. You get sick a lot. You would never equate it to your root canal, but you just, every cold that comes along, you got it. Or thyroid issues. You're all of a sudden have low thyroid levels, and they say maybe this is even Hashimoto's. Well, you would probably never equate that to your root canal, but it's all based on immune strength and your body's ability to keep its own immune system running as it should. So pretty much if you have an infected tooth, it's already affecting you. What's the difference between your toothpaste that you're developing and your current tooth pattern? Great question. All right, so there are a couple of things that it's funny because I am the only one that currently has the toothpaste. I have like six tubes on my bathroom counter because I'm trying a whole bunch of different ones, but just confirmed the final formulation yesterday. So it is going and we are on the way. The difference is and I go between them because the tooth powder actually, I think, is slightly better at cleaning. It just has a little bit more, that bentonite clay can kind of get in there and remove the particles. But there are some things that people don't love in the tooth powder. One of those is xylitol, particularly people who have pets. Xylitol is fatal, poisonous to dogs. So people wanted to have something that was xylitol free. So the toothpaste is sweetened with stevia instead of xylitol. The other thing is bentonite clay sometimes is a concern for people. So the toothpaste is clay free. So those are the two biggest differences. There are some other differences as well, but the hydroxyapatite is the same. So there's the same amount of hydroxyapatite in both, and we're going to have the same formulations. We're going to have a whitening version, a sensitive version, and a citrus version. So people who don't like mint will be able to use that as well. But those are the two biggies, is that there's no xylitol and there's no bentonite clay in it. And just paste. We have so many people that say, we love the concepts that you have. We love your idea of tooth products, but my kids are never going to use that powder, or my husband's never going to use that powder, or whatever it might be. So we really knew that we needed to make a paste formulation. That was the biggest reason. No fluoride here too in Canada, but what I saw is that instead of the fluoride treatment being separate, as I think people were refusing, my dental office now had it included in the polish. Thank you for bringing this up. There's a paste that we use when we clean your teeth. It can be actually in that paste, but there are a lot of pastes that are fluoride free. So just ask, okay, now is everything you're going to be using today going to be fluoride free? Good question. Can you suggest what kind of doctor I can go to get a CT scan? My dentist says my teeth look great, but they hurt. So you're going to ask and say, okay, when you call the office, do you have a cone beam CT scan? And really, we want a nose to chin version of a CT scan. So that's what you're going to ask for. Typically, you're going to find it at a specialist office. So an oral surgeon, an endodontist, a lot of general practitioners will as well. Anybody that's placing dental implants is probably going to have that. Anybody that's treating airway issues is going to have that. So those are the ones you're going to look for. What is your opinion? It says on water polo use. I'm going to guess that means on water pick use. I'm going to just make a little educated guess there. What is my opinion on water pick use? So I love water picks. They actually are great at getting into places that sometimes are difficult to get into. The thing that is the problem with water picks is that you actually have to use it for it to do its job. And most people just don't. You buy one, you're all gung-ho about it. You do it for about a month, and then it just sits underneath your counter and you never pull it out again. So the thing that I actually recommend is something called a shower flosser. It attaches between the wall and the shower head. And what you do is it diverts part of the water, not all the water, but it diverts part of the water. You can just turn it while you're in the shower. That way you've got warm water coming out of it. So it's not going to be too cold on sensitive teeth. It's warm water and you don't have to get wet. You don't have to pull anything out. It's already there. You're already wet. So it's not messy. People who use the shower flosser absolutely love it. So it's water picking, but without the mess, without the just kind of all the things. Now you can't put anything in it. Sometimes we'll say put like some colloidal silver or my mouthwash in your water pick because we want those medications to get into the gums too. You can't do that. You're just using straight up water. But usually people use it way more than they would a countertop version. So that's what I like about it. Yep. Oops. Water pick use. Yeah. When is this book available? So pre-orders are coming in October. I'm going to be starting to tell you everything about the book. I'm going to be starting to teach you all about it very, very soon. And this honestly is really, it's going to revolutionize healthcare because it's going to put it back in your hands. That's the goal. That's my goal, is to put healthcare back in your hands. So you know how to take care of yourself and your family and work side by side with modern healthcare. That's the key. We don't have to choose one or the other. It's how do we work together? How do we make this together? So pre-orders coming in October. We'll be having it in our hands about next March. Nothing in the publishing world happens quickly, but I'm going to be starting to give you all this information. I did ask a hygienist at a different office if the polish available without fluoride, and in a very quiet voice, she said they did or didn't. Exactly. So this is all kind of one of those sacred cows of dentistry. Fluoride is a sacred cow. And there's a lot of belief behind it that there's nothing else that we can do and that we have to do it. And anybody that asks us to do differently is a little crazy. I'll just put that right out there. They think you're all crazy, but you're not crazy. And you can just don't go in acting crazy. Just say, here's this research article. I actually studied it. I learned a lot from it. And I understand that, these levels of fluoride are higher than what we have in our water, but I'm concerned about just all of the fluoride I'm getting from different sources. So I prefer it if you could use a fluoride-free alternative for us today. What do you have? Just be kind. Just be nice about it. Yes, mitochondria. I had mold illness and learned mitochondria is everything. Can't wait to get your book. Yes, I'm going to teach you all about this. The whole premise of the book is unlimited energy, and I can't remember the subtitle. It's something like this: unlimited energy and amazing health. That's not correct, but it's close. What are the best ways to fix cavities? Okay, so the best ways to fix cavities are depending on the size of them. So if they're small enough that they're still in the enamel layer of the tooth, then those actually can be remineralized. So it's with the hydroxyapatite toothpaste or tooth powder, mouthwash, soon toothpaste, and the remineralization supplements. Now I know right now that our tooth and bone formula is out of stock. So I'm going to give you an alternative right now. The alternative that I like best, and actually I'm formulating a powdered mineral supplement, which I'm so excited about, but don't have it yet. Coming soon. But right now, the alternative is something from a company called Mother Earth Labs. And it is a liquid mineral, and it's excellent. So because you can't get ours right now, that's what I'm going to recommend along with the vitamin D and K. I've had great success using a poultice of bentonite clay, clove oil, colloidal silver on an infection, broken tooth, lost crown. Yeah, all of those things that you mentioned. Bentonite clay is great at mineral delivery and detoxing. Clove oil is a soother. It'll also kill, and it's antimicrobial. And colloidal silver is very antimicrobial. Doesn't matter what bug it is, it's going to kill it. So that's a great combination of all of this. Okay. Please explain leaky gums and how bacteria can leak into the bloodstream and affect the heart and brain. Great question. So your gum tissue is actually only one cell thick. It's only one cell thick. When we look at your palm of your hand, this is keratinized tissue. Keratinized means strengthened with something called keratin. It's what our fingernails are made of. The palm of your hands also have keratinized tissue. So it's tougher and it's thicker and there's multiple cells thick. Our gums are not. These are single cell thick. So when you have inflammation in the gum, what it's done is it's because of bacteria on the tooth, because of sometimes systemic issues, your body just has inflammation overall. Those cells are actually very fragile. They're inflamed. They're not passing nutrients back and forth very easily. And as such, they allow things past what's called the cell membrane. Again, this is all in the book. I'm so excited that you're asking these questions because it's all in the book. Talking about cell membranes and how these work and how you keep your cells happy. The whole premise of the book is how to keep your cells healthy and happy. But when those cells aren't happy, when they're inflamed, what happens is things can get by the defenses, it's called the cell membrane. It's basically the wall that keeps things out. That wall becomes less defended, and the body can't keep things out as well. So things get in. Well, when they get through that cell, they're going to be able to get directly through the other side, which is now the bloodstream on the other side. Bloodstream, all the vessels, and that's going to then, once it's in the bloodstream, it's going to go everywhere. And some areas that are particularly, they have an affinity or they like gum bugs, not like probably, but are just attracted to, are the heart and the brain. Those are two areas that those bugs really like to go to, particularly the heart. That's a big one. So when you have inflamed gums, it makes the defenses go down. Bugs can get through, and then they get through on the other side to the bloodstream, and they're going to go everywhere. That's the idea of leaky gums. So we have ways to strengthen your gums, make them tougher. Tongue scraping actually helps with tongue issues here, but the mouth rinse and the tooth powder actually make your gums a little tougher too. So I recommend both of those. Can the CT scan show if you have an infection and where it is and if your lymph nodes are swollen? So again, CT scan is going to be, my preference is basically nose to chin, or even eyebrows to chin is even better. If we can get eyebrows to chin, we can see even more. So we're not going to see lymph nodes. So we're not going to see that. And a CT scan shows us hard tissue. An MRI shows us soft tissue. That's a little piece of information you may not have understood. CT, hard tissue, which is what? Going to be bones and teeth. Or calcifications. We'll see calcifications in the brain and carotids and different places too. Anything hard. An MRI is going to show soft, which is lymph nodes, gums, brain, those kinds of things. So we're not going to see lymph nodes on a CT scan. Usually you're going to palpate those, but it will show an infection. How? If because the infection is going to be soft tissue. How's it going to show it? Because the infection eats away the bone. So instead of seeing infection, we just see a hole in the bone, and that indicates an infection. So yes, it absolutely can show infections, and anywhere. Again, eyebrows to chin, it's going to show anywhere that we see in the view. Some CT scans are here. They're super little, so you need to specify, I want eyebrows to chin. I want this much so that I can see everything, so we can see the sinuses, everything. I recommend water picks to all my patients. Where can we find the shower flosser? Shower flosser you're going to find on Amazon. That's my easiest way to find it, is just on Amazon. And there's no one brand. I think there's a brand called Shower Flosser. Go for it. Buy that brand. There's other brands too. They're all the same. Perfect. Somebody says, thank you for the answer. I keep a tub of the powder in my car, so I have it for brushing. Xylitol is also worrying with cats, and so I'm really careful. Exactly. It's worrying for all animals, so that's why we're doing this stevia sweetened toothpaste. Can't wait to buy your book. Yay, I'm so glad. Actually, and this is really exciting, all proceeds from book sales are going to charity. So when you actually buy the book, you're going to be supporting charity. I'm going to have 5, because I'm talking about the 5 elements of the earth, and we're going to have a charity that's associated with every single one of those elements, and you're going to be donating to charity when you buy the book. So I'm really excited about that too. None of the dentists near me do CT scans and checkups. One uses them for implants. Is this a must? I was hoping to make sure I have no infections contributing to my autoimmunity and infertility. You really need to get a CT scan to determine if you're going to have infections. So just ask them. Just say, I really would like a CT scan because I want to rule out any infections in my mouth. But if they don't do it, then they probably don't know how to read it either. So you need to kind of weigh that. It took me 20 years into my profession before I found out that fluoride is toxic. Hygiene school never mentioned fluoride toxicity, and they still won't mention fluoride toxicity because it is, again, a sacred cow of dentistry. So hygiene school won't tell you this, neither will dental school. They're going to tell you that this is the only way to keep teeth healthy, which I disagree with. I just bought your Healthy Mouth, Healthy You book, and I'm loving it. So glad to hear that. That is my very first book. And honestly, someday I'll probably go back and rewrite or at least do a second edition. But there is so much fabulous information that you've most likely never heard before. So go check out that book. It's an easy read. It's written for you. It's not written for the profession. It's written for you. Go check it out. I can't wait for the toothpaste. My kids are messy with the powder. Exactly. There are so many moms that are like, please, please, I can't handle this. They dump the whole thing out on the counter. It's expensive. I can't, I can't deal with this. I get it. What is the new book about? The new book is all about how you keep one cell well, because if you can keep one cell well, you can keep all of your cells well. So it's literally about unlimited energy, unlimited health, and how you can do it combining modern medicine and traditional medicine, the stuff you do at home. You're going to love it. What can be done if one has internal root resorption occurring halfway down a molar root? When the endodontist said that they can't reach the area with the root canal. So if you have internal root resorption, typically a root canal is not going to slow it down or solve that. What that is the body is literally dissolving the tooth from the inside out. So all we are going to do for you as well is try to slow down the process. Red light laser therapy may help. It's not been proven by research, but we find it some. Vitamin D and K and tooth and bone formula or a mineral formula may help. Again, not proven by research, but it's going to help. All of those things are hopefully going to slow down the process, and we just keep the tooth in your head until there's pain or an abscess or something like that. Then we usually remove and replace it. Title of the book, please. So the title of the book someone was talking about was Healthy Mouth, Healthy You. You can find it on Amazon. It's all about this kind of dentistry. Okay, I'm going to jump onto the other questions here. I had a root canal 4 years ago. Since then, I've had tooth, gum, and facial pain, especially in my sinus area. I've had 2 second opinions and both say it's okay. Now the dentist wants to do a crown. Suggestions. The suggestions are listen to your gut, listen to your body, listen to what it's telling you. I will show you story after story after story where people have been to multiple dentists, had multiple x-rays. Everybody says it's just fine. Then we do a CT scan. So that's the first thing is you need to get a cone beam CT scan on that tooth. We get a cone beam CT scan and they literally have a massive abscess extending all the way into the sinus. And they're like, how in the world did nobody see this? You cannot see it on a traditional x-ray. There's no way to see it on a traditional dental x-ray. No way. There's occasionally you can see it, but usually you're going to see exponentially more on a CT scan. So that's the first step. Cone beam CT scan, somebody who can actually read it to see what's going on. Most likely you have a new infection on that tooth. Is your mouth rinse okay for canker sores? Yes, in fact, it's fabulous for that because what it's going to do is soothe. There's marshmallow root in it, which is very soothing for that canker sore, but it's also going to kill any bugs that have now taken up residence, which slow down the healing. And it's very good. It has lavender, which is anti-inflammatory, which is going to help the healing process. And the colloidal silver in it is antimicrobial as well. So very good for that. How bad is stainless steel crowns on a toddler? My son had his procedure done and they put on a stainless steel crown instead of ceramic. This is one that we kind of have to tiptoe up to because we do completely metal free in our practices. That's just one of our tenants here at Total Care Kids. However, we know that that may not be possible everywhere. So the good news about that crown is it is stainless steel. It's not mercury. There are not the same issues that you're going to have with, say, an old mercury silver filling. And it is short term. It's going to be there for the length of the tooth, which the tooth will be coming out. So the thing I always tell parents is to watch it very, very closely. And what are you going to watch? You're going to watch the gum around it. So if the gum starts to get red or swollen, most likely that tooth is reinfected and you're going to just take that tooth out. But if you can buy a few years and hold the tooth in the mouth a little while, it's going to make it easier for when that permanent tooth comes in because it'll hold the space. So let yourself off the hook a little. It's okay. That tooth will be coming out. Can you talk about how to repair chipped teeth? Not enough for a crown. So you're going to use a filling material, just a simple filling material if it's a chipped tooth. Composite resin is the one that we typically will do in that situation, or we'll do an onlay instead of a crown, which just replaces the chip portion but leaves the rest good alone. So ask for either porcelain onlay or ceramic resin, composite resin filling. Which basic analysis do you recommend to see how healthy one's teeth are? So we do actually quite a bit. We look at all sorts of things, including, the wear on your teeth, the gum line areas. Do you have gum recession? Obviously, tooth decay. We look at gum infection or gum health around them. We look at all of that. We look at the way that they're organized. Is there enough room in the mouth for these teeth? We look at all the tissues surrounding them. And so that requires some eyeballs and an exam in your mouth, but always we do a cone beam CT scan. So that's really the basics for us. We already answered that one. Okay. Are there any dentists that I recommend in Georgia? So the answer is always go check out my directory. If you go to the Living Well with Dr. Michelle's site, we have a dentist directory on there. And that dentist directory has people throughout the United States. We are working on getting more everywhere. If you know someone that should be on that, please let us know and we will reach out to them because we just want to be able to send you to people that we feel good about. Are you familiar with Boca toothpaste? No fluoride, but it still has synthetic hydroxyapatite. And some doctors is not good because there's no long history research on the causes of synthetic hydroxyapatite. Okay, so here's the problem with the issue with hydroxyapatite. There is natural hydroxyapatite, and it is from cow bones. That's the source of natural hydroxyapatite. The issue is that we cannot get it very small. And the tubes that we're trying to plug up, the tubes that we're trying to fill that help to remineralize teeth and desensitize them and all the things we want from the hydroxyapatite, they're very small. So if the particle sizes are large, they can't fit into the holes. This is a problem. So we actually use, my tooth powder actually uses a synthesized version of hydroxyapatite as well, which is simply they put calcium and phosphate together and they make a complex that's hydroxyapatite. And it's small enough that it's going to get into the holes because I cannot find a natural source. And also there's a lot of people that are concerned about using ground up cow bones in their mouth. So there is no natural source of true hydroxyapatite that I found that's small enough to get into the tubes. Now, if you know something different, please correct me. I'm always happy to hear this, but that's the reason I've made the decisions I have. So Boca probably has a similar hydroxyapatite to what mine is. However, I don't love some of the other ingredients in Boca. They have SLS, which is sodium lauryl sulfate, which is a foaming agent. I've chosen a different foaming agent, one that I can feel actually very good about for that reason. So some of the other ingredients may not be what you love. However, they're all better than fluoride. So for the moment, Boca is probably a good choice. I love your tooth powder, but I'm concerned about my kids using it due to the xylitol and potential to hurt our puppy. We just had this conversation. The toothpaste coming out is going to be xylitol free. It's going to be sweetened with stevia, and it tastes great too. When is your bone supplement coming back in stock? Great question. We are now working with a new manufacturer because the old one could not get it to us literally for 6 months. So I believe right now we're on track to get that in October. So coming soon. But the alternative, like I said earlier, is Mother Earth Labs liquid mineral supplement. I love you and your passion for healthy living. Thank you. Thank you. Thank you for sharing that. Following my question about how bad stainless steel crowns are for toddlers, I asked last week about his procedure because he had to have a root canal and fillings done with crowns. Holistic dentist doesn't do sedation, so we're referred to a pediatric dentist that does. That's challenge for sure. Fillings are going to be pretty much fillings everywhere in kiddos, so you can be confident that everything's going to be okay for your child in getting that done. Honestly, the detrimental effects of tooth decay and infected teeth and losing teeth early and all of those things are actually worse in the situation than the procedures you're choosing because those teeth are going to be coming out. Are they both alkaline, even the orange? Yes. So what you're probably talking about is the tooth powder, toothpaste, all of the above. They are all going to be alkaline, and we wouldn't have anything acidic because that would be detrimental to remineralizing. We want minerals put in, not minerals pulled out. But the all flavorings are actually essential oils, which do not have the acidic component of the citrus. They have the oil component of the citrus. So yes, they are alkaline. Why does it have to be sweet? I would like a paste that isn't sweet. You're funny. You're just like me. I do too. I like a paste that isn't sweet, but 99.9% of the population likes one that is sweet. So unfortunately, that 1.0001% of the population, it's really hard to make something for you because I can the cost of R&D to get a formula, and I have to buy at least 5,000 to begin with. I need to find at least 5,000 people that are just like us that don't like something sweet. But if there's enough of us, we can band together and I'll make a non-sweet version. What is the biofilm control agent? I have missed it. Xylitol is great for that. Erythritol being an equitable alternative. Some use ozone or capped nanosilver. Great question. So the biofilm control agent ingredient in the toothpaste is actually a proprietary ingredient called protectin. And I have found this from a dentist that's in the Midwest, and her mission in life is to get this product into more tooth products so that it can get in more mouths. Because what it's doing is it actually selectively feeds good bacteria and starves bad bacteria. It's the coolest thing you've ever seen. And she has research to back all of this. And we are the first toothpaste to have this ingredient. So I cannot wait for this. It's going to be so amazing. Do you have a product for toddlers? I checked the website and could not find a toothpaste for kids. Absolutely. The citrus tooth powder is for kids. So why do we call it for kids? Just simply the taste. So that's why it is. Okay. Thank you all. This has been awesome. I just love your questions. Keep coming back every single week. We do this. I believe next week is going to be on Thursday, our typical time, but I'm so glad you're here. Thank you for your questions. Thank you for engagement, and just check out all of our stuff. We have a whole bunch of new things on YouTube. So if you haven't been on there before, please jump on there. Bunch of new material. I'm actually heading right now to film a whole bunch more for YouTube as well. Just trying to, like I said, clear a path through the mountains of information to help you live well in the world today. So thank you all.